everyone. My name is Dr. Leslie Rogers. I am the host of Mental Health Talk, and the goal of Mental Health Talk is to create awareness around mental health to reduce stigmas, which is really important. As we learned last week or the week before last, stigmas are important to understand because they interfere with us getting help that we need. It interferes with, potentially interferes with our understanding of disorders and understanding of presentations and things of that sort. And I think it creates biases. Stigmas create biases, right? And biases towards other people. It interferes with how we communicate with others, and a whole host of stuff. You can see the video. I posted the video last week, but it's important to understand stigmas. So tonight we're going to talk about depression. What is depression? Symptoms of depression, differences between depression and sadness, grief, gender, age differences with respect to diagnosis and reporting of symptoms, and when to seek help. So this is going to be awesome. I'm going to be on here for about 30 minutes going over this, and then I am going to end. So it's not going to be long. So the information that I had today was pulled from a lot of different sources on depression. And at the end of the video, I'll actually post those resources so that you guys can actually look this up yourselves. So depression's definition, let me see what this is saying. Okay. Depression, which is otherwise known as clinical depression or depressive disorder, is a serious and common disorder. It's common and it's a serious disorder. And one of the resources that I got is by Dr. Jessica Trussell from PsychCom. And PsychCom has wonderful information on many disorders. And it coincides with the DSM-5. Diagnostic and Statistical Manual of Mental Disorders, which is what psychologists and mental health professionals use to diagnose. So what is this depression? Depression is, again, a common and serious disorder. Those who suffer from depression experience persistent feelings of sadness and hopelessness and loss of interest in activities they once enjoyed. So persistent feelings of sadness, hopelessness, and a loss of interest in activities. Individuals can also present with a physical symptom, such as chronic pain, somatic symptoms, right? Chronic pain, digestive issues, and headaches. And these symptoms must be present for 2 weeks, must be present for at least 2 weeks. The diagnosis of depression, you have to meet a certain criteria, and that's what I'll go over now, and then we'll go over gender differences. So in order to diagnose with depression, you have to meet certain criteria. That's depressed mood most of the day, nearly every day, depressed mood every day that just doesn't go away. Diminished interest and pleasure in all or almost all activities, most of the day or nearly every day. Significant weight loss without dieting, you're losing weight but not dieting, or weight gain, decrease or increase in appetite, again, that word all day, every day. Fatigue or loss of energy, feeling lethargic, not want to get out of bed. Diminished ability to think or concentrate, so concentration issues. Sometimes it might mimic ADD, attention deficit disorder, but it impacts, your ability to concentrate or think. Thoughts of suicide with or without a plan. Thoughts of suicide with or without a plan. And recurrent thoughts of death. So symptoms must cause, and this is really important in order to be diagnosed with depression. Symptoms must cause the individual clinically significant distress or impairment in social, occupational, or other important areas of functioning. So depression has a high mortality rate that is associated with suicide. It has a high mortality rate that is associated with suicide. And depressed individuals also experience irritability, brooding, which is a deep unhappiness or thought, and obsessive ruminations, obsessively thinking about like negative events, negative communications, negative events, or you're just ruminating about it over and over, right? How is depression different from sadness? And if you guys have any questions, just jump in and ask questions. How is depression, and if I'm going too fast, let me know. How is depression different from sadness? Depression is more than just sadness, and not simply by a measure of degree, but it relates to the duration of these negative feelings. For example, sadness is a normal emotion that everyone will experience once in their lives. For like example, loss of a job, end of a relationship, you might become sad, a death of a loved one, such as grief, right? Sadness is usually caused by a specific situation, person, or event. Depression, on the other hand, doesn't really have triggers. A person suffering from depression feels sad or hopeless about everything. They're sad about everything, not a specific person, situation, or event. They're sad about everything. This person may have every reason in the world to be happy, and yet they lose the ability to experience the pleasure. Depression and loss, such as bereavement. Now, the difference between this and bereavement, when you're grieving, the sadness subsides eventually. It should subside eventually. Bereavement, financial stressors, or serious medical illness can also result in depressed mood. So I always throw research in here, and this is an article from in 2017, and it says, in 2016, depression accounted for fully 10% of the total non-fatal disease burden worldwide, disproportionately on girls and women. In one study, the global 12-month prevalence of major depressive disorder was 5.8% in females and 3.5% in males, which research shows that depression is diagnosed more than in females than males. And this is talking about gender differences. The gender differences in depression, generally believed to be twice as many in females experiencing major depression than males, represent a high health disparity. Gender differences in major depression diagnoses and depression symptoms peaks in adolescence, with the gender gap in diagnoses emerging earlier than previously thought, and the gender gap then narrows and remains stable in adulthood. So there's a huge gender disparity in adolescence between males and females, but that gender gap narrows as you become an adult. Yet, the magnitude of differences indicates that depression in males should not be overlooked. And that leads me back to that room that I do on Men Suffer Too. Depression in males should not be overlooked. So I thought it would be important for me when talking about depression to talk about the gender differences, because children, women, and men sometimes present differently and may report different symptoms that can potentially influence diagnoses. So in children, depending on what age, may report somatic symptoms such as tummy ache, headache, not feeling well, external behaviors like crying, irritability, and even anxiety symptoms. Sometimes anxiety overlap with depression. Symptoms sometimes overlap. So according to Dr. Jennifer Casarella in February of 2021, in children, these are things to kind of look for when trying to understand depression. Crankiness or anger, continuous feelings of sadness or hopelessness, social withdrawal, being more sensitive to rejection, changes in appetite, either increased or decreased, changes in sleep patterns with children, noticeable changes in sleep patterns, sleepiness or excessive sleep, vocal outbursts or crying, fatigue, low energy, trouble concentrating. Trouble concentrating is one. And again, that sounds like it overlaps with ADHD, right? But trouble concentrating, physical complaints such as stomach aches, headaches, that don't respond to treatment. So if you take the kid to the doctor and they get on medication or treatment and it responds to treatment, then you know it's not depression. And we'll go later on, we'll go on when to seek help. Trouble during events and activities at home or with friends and school, during curricular activities and with other hobbies or interests. Feelings of worthlessness or guilt, impaired thinking or concentration, and thoughts of suicide, death or suicide. And those are things to think of with children. And these are noticeable differences, and especially during this time around COVID, noticeable differences in mood and demeanor with children. Another population, men, it's important to know that men may present differently as well when diagnosed with depression or when being assessed for depression. So depression in men, this is a National Institute of Health. These are things to look for in men: anger, irritability, aggressiveness, feeling anxious, restless, or on the edge, loss of interest in work, family, or once pleasurable activities, problems with sexual desire and performance, feeling sad, empty, flat, hopeless, not being able to concentrate or remember details, feeling very tired, not being able to sleep, sleeping too much, overeating, not wanting to eat at all, thoughts of suicide, physical aches or pain, somatic symptoms like cramps, digestive problems, etc., irritability, inability to meet responsibilities of work, caring for family or other important activities, with men engaging in high-risk activities such as substance use, alcoholism, things of that sort. A need for, and this is what that says, a need for alcohol or drugs, withdrawing from family and friends, or becoming isolated. So not every man who is depressed experiences every symptom. Some men experience only a few symptoms, while others may experience many. And sometimes diagnosing men with depression may be a bit challenging for clinicians because of that. So when to get help? This is important. So when we're talking about depression in all populations, men, women, children, it's important to notice like noticeable changes in behavior, like demeanor or normal characteristics. Like, for instance, I was talking to a coach, a sports coach, a performance coach, and I was telling him that noticeable changes in demeanor, for instance, if an athlete is sitting on a sideline, an athlete usually is up, bubbly, laughing, hanging out with the crowd, but then you notice he's always sitting on the sidelines. He's always withdrawn or no longer engaged, no longer interested in pleasurable activities and things. Noticeable changes in mood, noticeable changes in behavior, right? Might make your antennas go up a little bit. Emotions, changes in mood. You physically look sad, appear sad, down, and in a dumps. Thoughts of suicide with or without plan. Even if the person does not have a plan, then that means that I would encourage you to get help. So usually the first stop is on primary care physicians to rule out any medical concerns, especially when you're talking about children and even adults, to rule out medical concerns. Speak with your primary care physician to assess for depression. And then mental health professionals. A lot of folks, when they asked me to do this, talked about either not having insurance or not being able to afford services for mental health. So listen, so if you don't have health insurance, Department of Social Services covers the Affordable Care Act, will have a component, Affordable Care Act, where you can go on their site and apply for health insurance based on income. And they do have a mental health component. Mental health professionals some will do pro bono services where there's no charge. Another resource is National Suicide Hotline. And I'm going to have this at the end of the video, but the number is 800-273-8255 is the National Suicide Hotline, 800-273-8255. So I wanted to go over this really quickly before we end, guys. Sometimes it's kind of difficult when you're trying to locate or identify a clinician to a mental health clinician, because we have so many so many acronyms at the end of our names. So I wanted to just go over these acronyms so that, and these are only some of them, so that when you're looking for a provider, you won't get scared and say, well, wait a minute, what are they, what are their professions, and what are their expertise, their area of expertise. So, okay. So you have a PhD, which is a doctor in philosophy, PhD. Here, students are generally trained following the scientist practitioner model that puts greater emphasis on research. That's PhD. Then you have a PsyD, which is what I have, a PsyD, which is a doctor of psychology. A PhD is doctor of philosophy. PsyD is doctor of psychology. Generally trained with greater emphasis on clinical work. I did not go to a PhD program because I was not interested in research, especially heavy research. Then you have something called LCSW, which is a licensed clinical social worker, holds a master's degree in psychology, and works to help individuals through both direct clinical counseling and more traditional human services work, like social justice advocacy. So LCSW is a licensed clinical social worker. LPC is a licensed clinical professional counselor, and or a LMHC. I know, see, it's a lot. LMHC, licensed mental health counselor, holds a master's degree, holds a master's degree in counseling or psychology, and concentration on using psychotherapy and individual interventions to help patients through mental health and wellness. So when you're looking for professional services, anyone with a PhD, PsyD, LCSW, LPC, or LMHC, or even persons, under these, you can by all means use. They all work, I guess, the bottom line is the same. They're just different models, approaches to how they provide psychotherapy and counseling. Everyone also has specialty areas, right? Some may have specialty areas, like for instance, if you're worried about your child, then maybe you could, when you do research, look for someone who specializes in children. Not all psychologists specialize in children. Not all psychologists specialize in like marriage and family, right? So those are specialty areas that you can look for, like a child psychologist or someone that specializes in working with children. So there's specialty areas as well. Like for instance, if they're trauma involved, PTSD, you will want a clinician that specializes in treating traumas and PTSD, right? So do your due diligence and do research. But again, if you have someone in your life that you think may be suffering from depression, contact your primary care physician. If it's your family member, contact your health insurance to see what providers are in your network. And if you don't have health insurance, again, the Affordable Care Act does have a mental health component. So I just wanted to come on here really quickly to talk about depression. Again, I think what I'm going to do is when I don't have a guest on my show, I am going to talk about a mental illness. So next time it will be anxiety. And you'll see a lot of times anxiety overlaps with depression, the symptoms. Any questions? And I'm right on time. I planned on coming on here at 7, getting off at 7:30. Any questions? Again, when I post this video, the resources will be at the end of the video. And you guys see me going back and forth because I'm doing something new today. I'm on Facebook, YouTube, and Instagram. So, I think this is important information. Important information when creating awareness around mental illness.